Welcome to Washington Policy on the Go. My name is David Bose. I'm the Communications and Marketing Director for Washington Policy Center. Sorry about that delay. In fact, one of the things we might be doing is shifting the start time for these to 12:15, just to avoid some of these difficulties. Plus, it'll allow you to have to grab your lunch from the refrigerator and do some other things to get this thing rolling. But the more observant of you might have noticed I put the 12:05 start time, but we're still about 10 minutes off. So I will likely change the start time to 12:15 coming up. Anyway, we've got a lot to cover today, even though we're just covering one center director, but that center director actually covers two centers. So it's kind of a twofer. We've got healthcare and workers' rights to cover today. And that's what we're going to get to right now. Also, I want to make sure that you check out our blog at washingtonpolicy.org. We regularly have updates on that blog, and there's a lot with this legislative session. We have a cutoff date coming up on the 31st that we'll have some updates on as well. So be sure to check in regularly at washingtonpolicy.org for the latest. Let's start with Elizabeth Hovde. She is our director for the Center for Healthcare and for our Center for Worker Rights. We're going to start on the healthcare front. What are you watching? What proposals are you watching right now in Olympia regarding healthcare? And generally speaking, do they follow a good approach, good policy, or bad?
You know what? I'm going to highlight for you today two bills that I'm hopeful about. One is a hospital at home services bill, a set of bills, Senate Bill 6101 and House Bill 2295. They have both, let's see, one of them at least has passed their executive session. So these are moving along. They allow some hospital at home service programs to be continued that were made possible kind of in the COVID era by the federal government with waivers. So these programs have been operating by hospitals, allowing them to free up bed space, increase access. The patients who take part in it love it. The doctors report it being a good program. There are quality assurance measures. People need to be checked on at home, just like they would at the hospital by nurse visits. So there are things that make this program a really quality program that we should continue to take advantage of after the federal waiver ends, which I think is this year at some point. I forgot right now.
What does the federal waiver do? I mean, what is it waiving, so to speak?
It's giving hospitals the ability to give these services at a person's home. So
it amazes me what we have rules for. You'd think that, the hospital with all the minds there that actually deal with disease and the technology and specify on how to treat people, you'd think they could tell you whether they could do that at home or
absolutely
not.
And a bunch of the administrators of these programs showed up at a House hearing last week that I was at also to testify on this bill, and they were giving the crazy, not the crazy thing, they're showing good outcomes. There are good outcomes for this program as far as readmission rates, as far as not having extenuating circumstances in these areas. They vet the people who go into the program well. These people have homes that can accommodate hospital gear, that can accommodate people being around to watch things. They're not just throwing people with transient home lives into their homes to deal with care and not giving them hospital care. They're vetting the people well for these programs. The homes are conducive to this kind of program. And what was interesting at the hearing was the State Department of Health showed up as well and testified that they were concerned about it continuing and that they really needed more control over what kind of guidelines were in place for vetting these people, and they wanted to be able to license these in a different way on their own. So they're trying to get their control around this program. That's shown great success. Hospitals are having great outcomes with these programs. So it just is discouraging that the only people that might slow down or limit this kind of innovation is the state. State itself
Uh,
is the one throwing up
but
the blocks.
but the bill itself right now is moving. Is that correct?
Yeah, the bill is moving. They ended up writing an amendment on the bill that would allow DOH's rules to take place as soon as the real rules are written. They could tighten up various aspects of the program. And until their rules are complete, it limits the program to only the hospitals that are already doing it right now. More hospitals could not take advantage.
Now, correct me if I'm wrong, but the cutoff that I referred to on for the 31st, that's the cutoff for the bill has to have moved past the committee it was referred to in the House of Origin in order to continue to be considered. It's committee cutoff, correct?
That's correct. There's also a fiscal cutoff, which is, I think, Monday, February 5th. And that would allow bills, any bill that has an impact on the budget to keep going. And but
That's a
generally,
get out of jail free card there. Or yeah, there's always workarounds for legislators, but still. And you mentioned that there was in addition to this innovation, which kind of reminds me, it reminds me a little bit of the nurse licensure compact in that you have something pretty obvious. You've got a bunch of nurses working in all the other states, and we have a block that says you can't come here with your license, which, I think from a common sense perspective, you say, what, that doesn't make any sense. Why would we do that? It'd be
that's
one thing if they had wildly different standards in other states where you're saying people are dying like flies over there. But we're pretty much, they're even going to our schools, and our nurses go to out-of-state schools, and so it doesn't make any sense. And now this is another one where with telecommuting and other things, people learning that, hey, there's a lot that people can accomplish without going to the brick and mortar building. And you have medical care units that are mobile right now. I mean, I was just reading about a medical van set up. There's mobile veterinary clinic in Pierce County. There's mobile dental clinics, and of course there's some fly-by-night ones that are illegal already, but the concept is provable, and it makes some sense. So what else do you watch?
well, that's a great segue about a bill I forgot to highlight for you. There is a bill that is moving, and it's hopeful. It would add us to a physician's assistant compact. Right now, the compact is not in force. You need 7 states to get on board. We would be one of those states, I think, still at this point. And it's encouraging and building on the success of the nurse licensure compact that we're seeing right now, and the regulatory burdens getting out of the way in that area. That's another one moving along. But the one I was thinking of this morning was a bill that's been proposed to remove a certificate of need law required for adding hospital beds related to psychiatric services. So that bill has been moving and should get rid of con law in just that one area. Of course, we should get rid of certificate need law in every area.
Yeah, let's start there. Remind me of the jargon. Certificate of need. What does that mean? What do we have to? They have to get rid of the certificate of need. How do those work? And I remember us talking about them before, because con law kept throwing me off until I worked out the acronym. How does certificates of need work, and why is this an obstacle?
It's basically a permission slip from the state that you can open up healthcare services in addition to the ones that already exist in a given area. There was the intention of this law decades ago was to make sure you didn't oversaturate an area and make healthcare costs more expensive. That is not the case. In fact, the federal government saw that certificate of need laws, which they enacted and encouraged all states to enact, were failed policy. They removed them from their structure. And most states, however, still have them. 35 states, I believe, still have certificate of need laws on the books in some form. 12 states have seen the light and allow innovation and competition to proceed without getting other competitors permission to open a service. So
Is that how that works? So in order to get your certificate of need, you'd have to get permission from the other providers, your competition, to say, yes, we could use more beds here. Yes, we could use more of the service.
They
right?
have weigh-in. I wouldn't call it a straight permission, but they're the ones letting lawmakers know what they should do.
Sure. Yeah. They're
And
the advisors. Yeah.
and there's no well, there's lots of places this could be useful, but psychiatric beds, we have fewer than national standards require by far. There is no reason not to remove con law in this area. And I think lawmakers are seeing that. And, and that's encouraging and hopefully a gateway drug to removing all certificate of need laws. There has been focus in the legislature this year and last year, frankly, for more workforce issues being less regulated than they are. And that's what we need. We talk about how this is not we don't have a free market healthcare system. And the more you get rid of these regulations and rules, the closer we get to having a free market healthcare system than we do. And then you could really judge it on those merits, but we don't have one. You can't judge it and say that a free market healthcare system is why costs are so high. We don't have one. We have a hybrid system. We have the Affordable Care Act provisions that make it impossible to have a free market healthcare system.
Yeah, and we have third-party payer in the free market parts for the most part, outside of a few examples like, LASIK eye vision, for example, where costs have gone down dramatically, by the way, over the last decade or 2 decades, and quality's gone up. And then there's I think that surgery center in Oklahoma is a cash kind of approach where you pay and then you might get reimbursed by your insurance company. Frankly, I don't know why insurance companies don't encourage it because the cash costs are so low there. It would make sense, but who knows? I can hardly decipher my own insurance form, so I'm not gonna guess on that.
And that's part of the problem with third-party care too, right? We don't have people who are invested in their healthcare cost and what route they take or who they go to for their services because they don't really pay for it. They get a bill, they have a copay. I mean, whether you're government dependent for your healthcare on Medicaid or Medicare, or you have an employer provided insurance plan, you don't have a stake in the game in the same way that you would if you were buying healthcare completely on your own. So, the third party payer is the enemy, in my opinion. Where you have informed consumers, research shows costs go down. That's what happens.
Yeah, even if you're paying for it outside of, or with some kind of medical savings account or health savings account where you're in charge of that money, and then that money, usually what Congress does, or they'll make some rule where you can't roll over funds or you can't, so that you don't want to lose it. So there's less incentive there. But to me, it's your money. You should just roll over the funds. And if you're in a healthy year, you should just build those funds up. And that way, when you're sick, you could use them. And it would just, I mean, it makes so much sense for people. I remember speaking with Senator Phil Fortunato when I used to work with him, and he was going in for a procedure, and he called around, and the first quote he got was somewhere in the 40,000s range, and he kept calling, and then I think he got it down to somewhere around between 8 and 11,000. So the difference was so huge, and he was so impressed by it. And you see that time and again when people are able to compare costs. But you also see when you call and ask how much something is, nobody knows. Not even the office that you're calling. Nobody knows. So that's a big sign of a big problem there. So those are the 2 healthcare initiatives. I know you also wear another hat, which is the center director for our Worker Rights Center. Are there, we haven't talked much about that so far, at least on this program, but I know that you've been following a number of pieces of legislation on that. Is there anything that jumps to mind now that people should know in that area?
Yeah, it's funny. A lot of the workforce issues do apply to the healthcare industry. So it's nice to wear both these hats and be able to keep track of a 2-for-1 kind of thing. So things like the physician assistance compact, that's also a workforce issue that allows caregivers mobility in addition to increasing patient access. So it's a great thing. Some of the things I'm scared about for worker rights is something, one bill, Senate Bill 5777, and its companion bill, House Bill 1893, have both passed their committees and are now in Rules and Appropriations. They would give you unemployment insurance benefits to striking workers. So changing our system in a fundamental way. You know, this has always been a program set up, paid for by employers to give workers recovery wages if they're laid off through no fault of their own. Even the background for this bill says through no fault of their own, people are eligible for unemployment insurance. But now we would allow striking workers, choosing to strike, choosing not to work, to get these benefits and deplete the program for people who don't choose to be out of work. So this is a really concerning bill, and it's moving along expeditiously.
That just blows me away because it strikes me that the concept strikes me a lot like if you were to say, yeah, have you ever served on a jury pool? Yeah, you ever been stuck there? Okay, well, I was called in for the jury, and you're basically making $5 a day or $10. I mean, it's just ridiculous, and nobody can afford it. And it really is outrageous how low they value citizens' time. And so you'll go there, and some people are getting stuck in trials that are going to last for a week or two. And so you've got, low income people stuck with no income for that period of time. It'd be like government coming along and saying, look, we're gonna quadruple the, we're going to start paying $200 a day for jury pools. If you're a jury, we're going to pay you appropriately if you can come up with a guilty verdict, because they're just weighing one side. It's like they're not going to come along and say, because we're paying unemployment for the striking side, we should pay for a basic profit sustainability level for the company. And this is government taking a side, and it's a blind side. It's not even that they're weighing the pros and cons of any given demand. They're just saying, oh, okay, you want to strike, doesn't matter what you're asking for, we'll keep you afloat. So there's going to be much less incentive to actually take any kind of deal. So that's
this is definitely another bill for the category of the government picking winners and losers,
right.
And this is definitely going to, in my opinion, lengthen strikes, not have incentive for people to come through with job negotiations. And because this is a social program that all employers are dumping money into, even the employer who employees love and don't have any work negotiation issues, they're subsidizing now this program for employers and strikers in those employment situations. So I think it's a really bad way for the state to go. I think it's going to cost us a bit.
And this is, and you're not seeing, well, let me ask you this. It's gone through one committee already, so it's beyond the cutoff, or?
Oh, it's passed the committees in both houses.
Okay.
They're now in Rules and Appropriations, and so we'll see.
It's sailing through. I'd be curious. It also puts employers in a tough spot if you're talking against it, because it makes it sound like you're taking a position in every strike, from here on out, even though what you're basically saying is it's got to be an even playing field. I mean, the unions also would have much less of an incentive to create any kind of strike fund because you already got one, and everybody's forced to pay into it.
And that's one of the biggest points here. You had people testifying in favor of this legislation who were saying we need a safety net for striking workers. And I agree, not all workers want to strike. There should be a safety net for unions who are pushing their employees to strike and not make money. They should be supplementing their wages. They should have a strike fund from their union's members' dues to handle this. This is not the job of every employer in the state who has nothing to do with strike negotiations.
Yeah, that's a really interesting bill, and I'll be curious to see what businesses have to say about it. I mean, if you're starting up a new business and your workforce is likely to be unionized, there'd be a lot to say to go somewhere else, where the playing field would at least be even on that. So that'll be interesting. What else are you watching in the workforce area?
This one is disturbing to me as well. House Bill 1959 has passed out of executive session and appears to be moving along. It removes the exemption that allows employers with fewer than 50 employees to not pay a portion of the premium they call it a premium, I call it a tax, a portion of the tax for the paid family and medical leave program. So in 2017, when this program was created by law and you were deciding who has to dump money into it, they exempted employers with fewer than 50 employees. Now they would remove that exemption and make them pay along with all the employers who are paying. And what I find interesting about this is this doesn't impact the worker. Whether you're a worker at an employer with fewer than 50 employees, or you're an employer at a business with more than 50 employees, you qualify for paid family and medical leave benefits through the taxes that are paid in the social program. So what it's doing, as I see it, is this is not a solvency safe program. They've gone into the red already, or threatened to go in the red until they had a general fund bailout. So they're needing to find more money to fund a social program that's harming workers, in my opinion, because low-income workers are having to pay some high-income workers so they can bond with their babies.
When you pointed out earlier this year, you took a look at some stats. I remember compared to, there's more people in the upper income bracket, in the top 20% income bracket that are taking advantage of this program than there are in the lowest income bracket taking advantage of this program.
Middle and upper incomes are the ones who use paid family and medical leave, and they are the ones benefiting. Lower income workers, which I think in most people's minds would be like, oh, I guess they do need paid family and medical leave. That's only fair. You know, people should be able to bond with babies, take care of medical needs in their household. But that's not what this is about. This is not a safety net. This is being used by middle and upper income wage people to take time off work to handle these things. So it's a problem, and they need more people to fund it because a lot of people, more employers, and all workers fund it, but they need more employers in the pool because people are taking advantage of it.
Yeah, this is one of those things where throughout my life, I mean, since I was 18 years old or younger, when I was watching politics and there'd be some bill proposed that was a mandate on people, they'd always leave a chunk of people off. You know, it's the classic salami tactic where you say, hey, this bill doesn't affect you, small businesses over there. There's no reason for you guys to get upset. We're only taxing the big ones over here. And then they wait a couple of years and it's like, P.S., now we're going to get you. And the other business saying, well, welcome to the party. You know, like Bruce Willis and Die Hard, you know, say, right. Hey, yeah, finally, now you're involved. And the others are like, I'm shocked to find out that we're now stuck with the bill. You know, it's like the free lunch is always a mystery.
It's going to make negotiations hard, right? When the state goes back on its promises. This is only a few years, and this is now what? Let's see, they passed into, it's been collecting since 2000. It hasn't been around that long, and we're already getting rid of the promise. We're already getting rid of promise. It's already doubled the tax rate in its lifetime. It used to be a 0.4% tax rate on an employee's wages. Now it's doubled to 0.8. So it's broken the promises there. It's breaking the promises to employers. It's paying out to middle and upper incomes. This program is a problem, and we should be repealing it, not trying to find more ways for everyone to pay into it. And you know, it was interesting, the testimony on this from the bill sponsor, who I can't remember the name of at the time, I apologize. She was there saying, you know, smaller employers are off the hook. Meanwhile, medium employers and large employers, even if we don't make as much money, so basically we're paying in. So basically a misery loves company, rather than talking about this program isn't working. Let's leave it and not continue to punish work. It's just to me.
I should let people know, if you have a question for Elizabeth Hovde, our director for our Center for Worker Rights, also our director for our Center for Healthcare, just go in the Q&A box at the bottom of your screen and type in your question there as we talk, and I'll try and incorporate it into our conversation. Question from Heidi: is there any limit to the amount of time a strike could go on under the bill that you were describing? It sounds like it could bankrupt companies if they don't give in to the demands of the union.
Exactly the problem. Yep.
How dare you, Heidi, for bringing up that inconvenient fact, you know, where, yeah, there's not going to be any time limit. Just keep that going. Well, not only bankrupt the company, but what about the unemployment fund? I
Yeah,
mean, there's always talk about increasing the rates of unemployment because there's not enough money in the fund. And now if you're gonna do this for people that are not unemployed through no fault of their own, but by choice because of an argument that they're having, I mean, I know I'm sure there's some union workers out there. It's not choice, it's right. Well, I get that, but still, it's not the same as just losing your job. You're choosing not to anymore, and so that's going to be really tough. And I think it'll spread rate increases to everybody if I'm right on that.
I do
So
too. And I think again, workers who feel like this is their right to strike and that that's a good thing and they have support to do this from their union should be asking unions for this fund. Let's, God forbid there be a law that unions offer a strike fund to the employees that are choosing to go along with the strike. But, unions say they represent their workers. They haven't been representing them well. Unions didn't come to the side of people who chose not to get the COVID vaccinations. They are not making it easier for the employees who they say they represent to strike when they want them to strike and encourage them to. I don't know what they're doing.
yeah, and I mean, I know one of our recommendations has been for private unemployment insurance. And one of the reasons has been we're already paying more than other states for unemployment insurance for people. And with this, I would assume that would make any kind of move toward competition harder. But it certainly sounds like it would make the unemployment insurance, so to speak, more expensive because
Yeah.
you're going to have a much larger demand for that limited amount of money. Anita's asking, when the long-term care tax folds, or if it does, do you think we'll be refunded on that?
That's a great question. I have not thought about it too long. I've been just thinking about how to get rid of this thing. I I don't know. Part of me thinks no. I mean, they've got to pay for the damage already done. We're into this millions of dollars through the planning and extended planning and tweaking and amending. And so I don't think there would be a way for that to happen. And I don't know how they justify that or make it go away, but they'd have to do something. I just don't know what. And that's a great segue for what's going on in the long-term care world. On Thursday, Initiative 2124 was certified. And that is the initiative that would make WA Cares an opt-in program rather than a mandatory program for W-2 workers. So we'll see where that goes. The legislature is not addressing it yet. However, it is considering 3 bills that would further fix problems associated to the long-term care law. One of those bills had a hearing last week, and it is one proposed, I think it's 2467, House Bill 2467, and it would create portability for people who move out of state. That's one of the big complaints, as you can recall, most of you, that if you move out of state, no matter how many years you poured taxes into this program, you get nothing. So this bill would make that so, but what is not being highlighted and what I think lawmakers need to be careful of is that in order to make this happen, which is a recommendation from a committee that a lawmaker has now proposed for legislation, they would move the goalpost. They would make the number of hours required for a worker to earn a qualifying year in WA Cares 1,000 instead of 500. So they're creating more hurdles to qualification to move this hurdle for qualification if you move out of state. So it could impact more workers than it will help. Who the heck knows? But they just need to repeal this thing because the law is broken in so many places. You could tweak this thing forever. And that's the takeaway here. They're considering 3 more tweaks to this law. This law can change constantly. None of the promises are secure. There is no guarantee. And they're telling workers to have peace of mind that their long-term care services are covered later in life, when no one can have that guarantee. The eligibility standards are already strict. They're going to get harder if they make some of these tweaks, and we're going to be in trouble. This is going to be like paid family medical and leave. The rate there has doubled. I don't see the rate here staying the same. And it is interesting to see if voters do what lawmakers will not do, and that is make it optional for people to be involved in this. I have a feeling they wouldn't reimburse people for their stuff so far. I have a feeling it would get tweaked into a fund for aging and long-term support services, but that's just my guess, and I don't know enough.
Yeah, it reminds me of Illinois, where Illinois just poured on the promises over many years, and they're wildly underfunded on their pensions and other things, and they haven't had to pay the piper yet. But at some point, people that were promised the moon, and some of them are getting the moon, at some point you run out of the money.
Yeah.
And I don't know when that point is for them, but I know that they're hoping for a federal bailout of some kind. But it's a challenge, especially when you can't print the money. If you're federal government, you just keep printing the money. Let the smaller packaging and inflation take care of the rest for other products. But
yeah,
if
and
you're
voters, as they consider this, it should not be lost on us that the services that can be paid for with WellCare's dollars, even if you qualify, have to be approved by the state. Your caregiver is going to have to be approved by the state. Even if you're in another state, they're going to have to meet Washington standards. So there's just so many moving levers here that aren't going to work out for workers in the end. And this is a program that harms low-income workers, like paid family medical leave. They will be stuck paying the long-term services of people with plenty of resources who don't need government help.
Before I get to a question from Matthew, one of the things you pointed out struck me, and I wanted to bring it up. There was certification of this initiative already, and according to the state constitution, these are the legislature's paramount duty. Each initiative sent to the legislature by the people is the paramount duty of the legislature, and there's not a hearing on one of them that I know of yet. I know that there's a rally plan for people demanding hearings, and that does seem like, whether you like the initiatives or don't like the initiatives, it's pretty clear in not just the law, but in the Constitution, that these are the things that the legislature must deal with, and they don't seem interested. You'd think a hearing would at least would have at least happened by now. With that, you got what, over 400,000. You get how many signatures for each one? I mean, there's a lot of signatures. We're talking about a lot of people. That's no easy task, regardless. So plenty of people have had a lot of money and tried on these things, and they fail because they can't get the signatures. So getting signatures is tough, and it shows that there is a strong public appetite out there that the legislature should at least listen to, since that's their job. Where does the federal government, this is from Matthew, where does the federal government get its power to regulate hospital care in individual states? That seems like such an overreach on states' rights. I always like those principal questions, like, where does that come from? I don't know the answer to it. I feel like, the Commerce Clause has kind of been used for everything there. There's got to be something in there, but.
Well, I'm not going to have an intelligent enough answer for you. I've just started following this bill and actually just heard about the waiver about a month ago when this bill came up. But my assumption is that because the federal government controls Medicaid and Medicare, and that's a federal state, Medicaid is a federal state program. Medicare is federal, but Medicaid is a state federal program. So they are integral in picking the wages hospitals receive for care. The state also is involved in that. There's a lot of federal state interplay on what hospitals can or can't do regarding services provided to people that they are the payer for. And this is one of the biggest points about long-term care law and Medicaid in general. To fix this long-term care problem, lawmakers wanted this WellCares so that they could lessen their payout in long-term care services through Medicaid. What they could do is reform Medicaid and not let it be abused for long-term care insurance. It is a safety net. It is not a long-term insurance program. And yet every financial planner you know can talk to you about how you can shelter resources and income in a way that makes you qualify for the government to pay for long-term care through Medicaid. A lot of people don't want that care because they find it to be substandard, but it's available right now in a program through Medicaid. And that's what lawmakers should have their energy behind, is prohibiting abuse of this program. We need to help people in need. We all have a healthy appetite for being generous taxpayers and helping people in true need. But when you're handing out money to people with more resources than people in need for long-term care or for paid family medical leave, etc., that's when we get annoyed. And they could put their energy toward reforming Medicaid. But back to the question, I think that is where the interplay is with what hospitals can and cannot do, and why a waiver was issued by the federal government that some hospitals applied for and took advantage of. And
Before we get to a final question, is there any other piece of legislation you wanted to alert us to
let me
in this
think.
category?
There was one I had listed
I
here.
mean, I know these things change over time, and
Yeah.
you just never know. And by the way, I do want to remind everybody that all the Senate directors are posting and reposting material on this legislative session at washingtonpolicy.org. So you can check out the latest on their blogs. Todd Myers has been doing updates, as says Mark Harmsworth, and Lee's got her new education video that is going to be emailed out today. So if you're interested in that, be sure to check out our Friday email, because we'll link up to it there as well. So there's a pretty constant material coming out of WPC. Was there an additional one, or can we?
Yeah, I'll bring up this one just because it's related to the one I mentioned about giving benefits to striking workers. There's a bill that I've seen lobbied for, Senate Bill 5109 and House Bill 1095. They were heard last year. They would also change the state's approach to wage replacement in a significant way. They would create a program like our unemployment insurance benefit program to offer benefits to workers who are not eligible for the UI program because they are not authorized to work in the United States. So the state seems very friendly to ideas that would allow undocumented workers taxpayer provided services here in the state, even if the federal government does not allow the ability to use some of these programs. And what if it comes up, like I'm not sure if it's going to, it hasn't come up in committee yet, but they heard it last year, so it could come back reinstated from the point that it left off last year. And so I don't want to talk about it yet because I don't know if it's going to come up or not, but I'm watching it. The lawmakers really need to understand the significant legal issues with the bill. Federal restrictions on employers cannot be ignored, and this bill would create circumstances by which an employer will be made aware of the immigration status of these workers. And that's going to be bad.
Question for you: why do they not take into account not everyone can qualify for long-term care? People do have plans that cover things that are not considered long-term care. I think you've brought that up in the past before, where there's varied ways to cover this.
And not all of us are gonna need long-term care. That's another one of the unfair parts of this bill. We all have life needs. Making us save for one life need and not the other life needs we're gonna have just limits financial choices, healthcare choices, and services. But Dave asked the question again. They were wondering.
Well, they were wondering more along the lines of about how do you cover? They have plans that cover things that are not considered long-term care. People have plans that cover other things, and I think it's another way of saying some people make plans that they're going to provide for themselves that wouldn't be long-term care coverage, so to speak, but maybe you bought a piece of property and it's been appreciating in value, and that's how you're going to pay for your needs when you're older. Things like that wouldn't necessarily be insurance on that, but that's what you're using for. This it's part of getting older. You're trying to store up money to pay for that.
And that's the point. It was really not cool for the state to pit private long-term care insurance against a social program for long-term care service supplication, right? All of us save for things in different ways. We invest in different ways. And so that is part of the point. They've taken away the financial choices to save and invest for life needs. And on the back end, I have a strong hunch a lot of our healthcare choices surrounding long-term care, if we are eligible for the program, are going to be limited. Already, we know that caregivers who we choose have to go through a state program to be chosen.
Yeah.
So it's going to be a mess, and the long-term mess isn't going to get better in 3 years when the payouts begin. I think they're going to get worse, and I think people are really going to regret this thing.
Final question for you. This question from Heidi. I went to a legislative session in Clark County. There was a discussion about Medicaid reimbursement for providers being too low. The discussion was focused on a provider that services low income and people who do not have citizenship. Do you know the status or increasing reimbursement? And is there any limits for migrants? I'm assuming that she's meaning people who are not here legally.
I don't know the status of that, but thanks for reminding me to check. Last year in the legislative session, there was a lot of talk about Medicaid and Medicare reimbursement rates and how they're too low. And I haven't seen any of that so far this session. However, we're in the committee phase where new stuff is heard. So I would assume some of those things will pop back in next week. And that's a great thing to watch.
And I remember Dr. Starr talking about that too. This is a problem that's been around a long time, where doctors and hospitals and others are getting reimbursed rates that don't actually pay for their expenses. I mean, it's another way of government coming along and creating this mandate saying we're going to provide for this, and we're going to get this third party to pay it, and we're going to save money by not paying them. Which it's it reminds me of in the Declaration of Independence when they're saying you can't. We don't want the king throwing his soldiers into our homes and not paying us, for the rent. There's a similar kind of principle at stake here, where they're just kind of, we're gonna give this service away, and we're gonna make somebody else pay for it because we don't want the political consequences of actually taxing enough to pay for what we're giving people.
And Heidi brings up a great point. Our state has expanded in many ways. We're not only expanding Medicaid to people who are able-bodied instead of just focusing on the disabled and pregnant women, etc. It's now in Medicaid expansion that was allowed by the federal government. We took advantage of it right away, have been paying out more low reimbursement rates to hospitals while taking more and more people that we can't pay for. And we have expanded benefits to undocumented workers in our social programs as well. So this is going to end badly for us.
I always like the phrase undocumented workers too, like you forgot your wallet at home or something, It's like, man, I don't have them today. So anyway, but it's a good PC nod. Elizabeth, thanks so much for being on the program today. It's been a while since we last visited, and I know you're constantly busy and watching so many pieces of legislation on 2 different tracks that I shouldn't actually interrupt you at all during the legislative session, but I had to. You're so fine. Appreciate you informing us today.
Yeah, and know that there are at least 60 other bills on my list that, because they're not moving right now, I'm not looking at them. But
did you say 6 or 60?
I said 60. And that's what I thought. That's pared down. So I'm just paying attention to the ones in committees right now that we know are going places.
Yeah. So if one of them jumps up and leaps up somewhere, then we'll just point to you and say, why? Why didn't you follow that one closer? So it's a tough call. Well, thanks a lot. And we'll be back next week at 12:15. I'm going to change that start time to avoid this issue that comes up from time to time. And it'll give us a little bit more time to handle any technical difficulties, because Microsoft Teams and Zoom don't seem to like each other for some reason. But that's a subject for another day and another show. Thanks so much for joining us. Be sure to check out washingtonpolicy.org, and our new policy guide is available on our website. You can see in one glance how to go to a better Washington. We have, 60,000 words or so telling you how to create a better state, what some solid policy changes would be in all the areas that we cover. and recommendations for changes that would make Washington a better place to live, work, raise a family. So be sure to check that out. We have physical copies, but the digital copy is free if you go to our website now at washingtonpolicy.org. And we'll soon have another version to release, but I'll save that for another day. Thanks so much for joining us, and we'll see you soon.